Good evening. Welcome to this yet another interesting episode of DocSpace Plus. Good evening, gentlemen and ladies. Yes, I mentioned men first because I do hope that there are more men watching this than women. Pregnancy is such a wonderful occasion which is celebrated not only by the lady but the entire family and friends around. However, lady is often left alone to suffer or blamed for the lack of pregnancy. It's the misconceptions in our society which solely blame the lady for this condition. Today, DocSpace Plus with Indian Fertility Society attempts to address some of these misconceptions in the first of our four-part series, Not Her Fault, Alone. Friends, it's a great pleasure for me to have two stalwarts from the artificial reproductive technology space coming in and addressing us on these misconceptions. It's a pleasure for me to welcome Dr. Sudha Prasad, who is the president of the Indian Fertility Society. She is the director of Matritva Advanced IVF and Training Center at Delhi. She is a lady who's got immense 38 years of experience in teaching. She's been one of the stalwarts in introducing IVF and reproductive biology in India. She's been a professor of IVF and reproductive biology at Maulana Azad Medical Center, bestowed with many state awards, international awards, and a forefront member in various gynecological societies. Along with Dr. Sudha Prasad, we have Dr. Neena Malhotra, who is the professor at ART Center, Department of Obgyn at AIMS in New Delhi. She also is the Secretary General of the Indian Fertility Society. She's had international trainings in Scotland, in US, and many other places. She is award winning of multiple international awards. So friends, today you're going to hear it from some of the best doctors in India, not only in India, if I would say, dare to say in the world, around assisted reproduction. So please do put in your questions into the chat box and listen to these two wonderful doctors give you the right direction and guidance. Over to you, Dr. Neena Malhotra. I invite you to start the evening. Thank you so much.
Thank you, Bhayesh. Good evening, friends. Infertility or childlessness is not an uncommon problem. Facts say that 1 in 8 couples world over suffers infertility or childlessness, with a common belief that it is a woman's fault. But the matter of the fact is that it is a couple's problem. If we were to look at statistics or figures, it suggests that the male partner or the husband is responsible in 1/3 of the cases. In up to 35 to 37% of the cases, it is a woman who may be the responsible for the problem, while in 1/3 cases, it is both the husband and the wife. And the rest 10-12%, when we do not have the answer to the problem, it is caused as unknown or idiopathic infertility. Therefore, today, the Indian Fertility Society, along with DocSpace Plus, has started an initiative, a movement called Not Her Fault, an initiative that enables awareness for our patients and the lay public, helping them solve and find answers to their problem, and definitely take them forward in their steps when they move forward in their journey of parenting. Trust me, we want to help you find an answer to your problem. So today joining me is a stalwart, as Bhavesh has introduced, Professor Sudha Prasad, who has experience beyond years in treating couples, both from the government sector as well as in the private. So it's an honor to have Professor Sudha Prasad Madam with me today, and we both will talk about the reasons and problems to understand why we need to actually, begin and start investigating or testing the women. So Madam, we just want to know, when should a woman start getting worried when she doesn't have a baby? And what would be the causes that lead to this problem?
Yes, Neena, we have a very big magnitude of infertility in our country. And I will tell you this, that education is very poor in our country, so everybody do not know what is the fertile period. When this during the menstrual cycle, which days are the golden days when they should start having sex, and it will be a greater chance of having conception, implantation during that period. So I will just say that if the cycle is 28 days, then that means the egg is forming, egg is releasing, and chances are there, if the relationship will be there between 10th to 20th day, alternate day probably is the best chance. But there are the different causes also. If everything is fine, but the conception is not occurring, like if the menstruation cycle is prolonged. If the cycle is prolonged, then if it is a 45 days, it itself indicates that the egg is not forming, because chances are there, if the egg is not forming or egg is very weak, then probably the conception is not going to occur. I will show you. This is the uterus, and here there are two beautiful fallopian tubes with the good tantrums, the fingers, and here is the ovary where the eggs are lying in the body. Eggs are the stored, and it never increases with the age. And you can see, as soon as one egg is released, the fimbria, the fallopian tube, fingers catches and it pushes inside the uterine cavity. It is so simple that it goes very well. And then if at that very time, when the ovulation is occurring and the fimbria has caught the egg, then if the sperm comes, chances are there that the fertilization will occur. So this is the normal story, how the conception occurs. And if the fertilization occurs, then this is very much important that the implantation will occur. Here is the uterine cavity, and if the bed for the baby for the implantation is very good, then the baby will be there. So all these are so much interlinked that it has to be there correctly, then only one can have the pregnancy in that very cycle. But other than this, what happens when the obesity, the women is little on the obeser side, then chances are there the pregnancy cannot occur, because the normal ovulation is not occurring in that cycle. So we need to have at least 5 to 10% of the obesity on the weight should be decreased. Then only the spontaneous pregnancy can occur as soon as the obesity is decreased. Another cause in our country is the tuberculosis. There are so many asymptomatic tuberculosis patients are there. There are the droplets in the air, which is inhaled, and finally, absolutely without any symptom, it can go in the uterine cavity. If the uterine cavity, the layers of the uterus are harboring some tuberculous element, then chances are there the implantation, the successful pregnancy won't occur. This is very, very common. We did study and we found nearly 12.4% of the patients in our country are harboring the genital tuberculosis or the endometrial tuberculosis, which really requires to be treated before we want the conception. Another problem which quite frequently the patient comes with, polycystic ovarian syndrome. Patients are little obeser, and so many follicles are there, but they are not very much sensitive to the hormones. This is the problem. They have the eggs, they have the follicles, but the hormonal imbalance is so much. So these patients, these women requires the support, the assistance of infertility specialists. These are very much important for going right in time to take the assistance of infertility specialist. One more problem I can think of, that thyroid. The thyroid problem, if somebody is there, which is called hypothyroidism. If the hypothyroidism is there, then chances are there that this patient can have low or very weak kind of ovulation, weak kind of egg formation, or no egg formation, or if implantation will occur, chances are there that this patient can have the miscarriages. So these are the few things which are very important to understand. In our country, another thing is menstrual hygiene. People who all are on the rural side are having so much of a problem to keep a very good menstrual hygiene. So chances are there will be a ascending infection. If there will be a infection from below, then it can go above and then it can block the tubes. If tubes are blocked, then chances definitely are there the pregnancy cannot occur. So these are the important things which really requires to have attention out in time. The patient should consult their nearest doctor what exactly is happening for this. Because if in 1 year time of the after marriage, if normal sexual relations are there, if the pregnancy is not occurring, then chances are there definitely they should consult to their doctor. I hope I have made it clear the causes, and my listeners must be realizing what exactly can happen with when the infertility occurs. Yes, Nina.
So if I put it simple, then means if we talk to our lay people and lay patients, then that means she should be ovulating regularly, as in she should be having regular cycles. So we get this feeling that if some woman is having 28-day cycle, she is most likely to be ovulating. That means she is releasing an egg in the middle of the cycle, which we say is the ovulatory phase. That means her tubes should be open. As you rightly and very beautifully said, that she should not be having any ascending infection, like in the form of any period pains or discharge, suffering any history of tuberculosis, keeps a good hygiene, then her tubes are likely to be open. And of course, her lining, which is the lining or the bed or the soil, which is the lining of the womb, should be healthy, as in she has not suffered any past diseases like tuberculosis. So somebody who is healthy, who's not obese, who has regular periods, is somebody whom we can think to be having chances or good odds of having a pregnancy. So I think, as you rightly said, that if she's been trying consistently, that means the couple is not using any contraceptive, they are trying religiously and they are devoting their fertile period to having frequent sex, alternate days, as you pointedly said, between 10th to the 18th or the 20th day, then they should only get worried if, with consistent trying over 1 year, they don't have a baby. That's what I can sort of put it, madam.
Yes, very rightly said. Now, Nina, why the frequency of intercourse is very less in our country when the people are more educated? You can just highlight this.
Yes, I think we are realizing that we are getting more and more advanced. We're getting more high tech. We are really pushing our the women and the couples are pushing their, priorities are changing, pushing fertility behind and getting careers ahead. So with the kind of added stress that we have created with the environment around us, I think we can not deny that sex activity is also reducing. The couples are working in the corporate world where there is pressure for work. The working hours are long, and in corporates like Delhi and Mumbai, the traveling hours are so stressful, but by the time you're reaching home, you are so tired. So if the husband wants, honey, I think it's not the right time, I'm too tired. And when they're really wanting, it is rather not, they have missed the golden period. So I think that is one very, very common reason. And I think it's very important when we say sex on demand, when we tell them, look, you have to have, this is the best time. This is what we call as a performance anxiety. And that is also adding up, because when we know that we put the stress that this is a time, if you don't try, your chances are less. I think that also perpetuates or adds on or aggravates the problem. So I think it is no doubt that if we expect them to have sex alternate day, it's kind of unthinkable when they say, oh, we just try weekly, I mean once a week, or we try 2 weekly, I would say it, in terms of being 2 week. So that is something which we have to stress, that it is to understand that the golden period is definitely there, but if not alternate day, even if you try it once in 2 or 3 days, is going to be useful.
Very rightly said, Meena. The golden period is very much there. That won't wait for anybody, and that cycle will just go away. And we are just depleting our ovarian reserve, the follicles, the eggs which is lying in the ovary. We are just depleting if we are not utilizing right in time. Very rightly said about it.
And I think one thing that I think, madam, you will acknowledge, that the age of childbearing is also moved forward. If you looked at women in the 20s, they felt nice and they were kind of thinking of pregnancy. Mid-30s is what the commonly belief is, that, oh, it's time to build a career. And by the time they're moving to realize, the ovaries are also getting depleted of their follicle pool. So I think we have to stress that the further you move in age, the chances or the odds of having a pregnancy are reducing. So it is also important that age has to be taken and given a due respect in terms of thinking of your pregnancy. So that is relevant again in the present day and age.
Very, very rightly said, yes. So we were talking about the tubal patency. Tubes can be blocked also due to various reasons. Is there any method that we can just see that why the tubes are blocked and how it can be opened up? And there are how to make the diagnosis that yes, my tube is blocked. Is there any easy method?
Yes.
Because it should not be painful, I must tell you. It should be the easier method by which we can find out.
Yes, I think as he rightly said, that we can know if she has a regular period, she's ovulating. We'll also talk, but to test whether her tubes are open, I think as history has already given us a hint, but when we talk about checking and getting a confirmation that the tubes are working and the fallopian tubes or the finger-like, prong-like things which pick up the eggs are very much in place functioning, we have a simple test called hysterosalpingogram. Now this is a test with which we push in dye through the neck of the womb, which we call the cervix, and the dye which is pushed in goes and an X-ray control, which we call as a hysterosalpingogram, stains the lining of the womb, flushes and flows through the tubes and comes out. And this is when we say that there is a free flow, which we call as a fill and a spill. So if your doctor is happy to sort of check on your history, understand that you do not have any risk factors, and you are free to go for a HSD, the right time of the periods is at any time after the 8th day to the 12th day, or rather a window between the 7th to the 12th day will be the right time to go in for a hysterosalpingogram. But mind you, this test has got its limitations. It has to be done only after the advice of a doctor. B, it has to be done by a radiology setting where there is a good X-ray and a control, and certainly somebody who is well trained to push the dye, not by somebody who is a novice. Of course, there will be some checks that will be done before you are called for the test, checking out whether you do not have an active infection. Also, some kind of a pain relieving medicine will be given, because as the dye flows through the neck of the womb and is flowing down the tubes, there is a slight kind of a spasm that happens to some patients. So if you're mentally prepared that this kind of a discomfort will happen, you will be better in taking up this test. Certainly the tubes are the ones which show the tubes will show the dye coming out, and that's a happy sign. But then we should not get disappointed that if the tubes are blocked, it is always a tubal block. That means your tubes are not functioning, because into 1/4 cases, that means up to 40% of the cases, there will be a state where the hysterosalpingogram may show a blocked tube, but actually the tubes are open. What we call it as a false positive. So that is something which we must reassure that it is giving us a lead, but because the lady who's undergoing a test keeps it very tight, or there is a state of spasm, then the tubes will not allow the dye to flow. So that is something which, again, you have to consult and get back to your specialist doctor rather than get depressed. I think that is about, but I think, madam, as we're talking about the tubal evaluation which will be done, do you think there's something that we can do before, some kind of ultrasound that should help the lady, or should we just say yes, that there can be a lot of information if she needs something basic?
See, ultrasound scanning is very much important, which can just evaluate the pelvis, what exactly is the uterus, how the tubes are. So what we do on the second day of the period, during menstruation, if you get the ultrasound by transvaginal sonography, that is called, there is a transvaginal probe, and it is not at all painful. Sometimes you feel the spasm, but if you are relaxed completely, easily one can get. And as the probe is covered by a sterile condom or the probe cover, so it won't get any infection, any type of trauma one can have by this. And with this scan, you can see the whole contour, whole uterine cavity, how it looks like. Sometimes in the uterine cavity, there are the wall of the uterus is thick. That is called adenomyosis. If the thickness is there, probably there will be some problem when we will try to give you medication, or the conception will be there. Chances are there it can decrease. And if there is in the wall, if there are the small fibroids, small tumor, which is absolutely 100% benign, if they are there, if they are very small and away from the bed of the uterus, there is no problem. I will just tell you this, that it is not going to give any trouble while doing conception. But unfortunately, if there is some fibroid sitting inside the cavity and hanging in the uterine cavity, so already the fibroid is there, probably the pregnancy cannot sit, because there is only a place for one thing, either pregnancy or a fibroid. So we have to get it removed. That polyp, that fibroid should be removed before we plan the pregnancy. If we just see on the fallopian tube side, if the fallopian tubes are not visible by sonography, when we are doing the transvaginal scan, it is not visible at all. But if there is the fluid filled up in tubes, yes, then problem will be there. That fluid should not be there inside the fallopian tube. If it is there, this is the number one sign of having infection, and the tubes are filled up with the fluid, which won't allow the pregnancy to continue or pregnancy to implant. So that requires the surgery. You have to consult your nearest doctor. If it is very much there, then you should know that this fluid is having the toxic agents, which can just won't allow the pregnancy, which is called hydrocephalus. Dr. Neena already said that if it is tubes are blocked, then we won't be able to see at all anything. And if there is a endometrium is very thick, the lining is very thick, sometimes we can find out also that there is some thickness in the lining, and we may need to take a small biopsy and to send for the histopathology whether it is a normal or some malignancy is there. So don't be afraid of this. It is very painless, and one can do on this. When you do on the second day, when we see the ovary, I said it is already the stalk of the eggs, where you can see how many eggs are there in the ovary. Both ovaries can be visualized one by one by the transvaginal probe, and we can see the eggs, that is called antral follicular count. If the antral follicular count is very good, then chances are there that you have plenty of eggs in you, and according to your other investigation, you can have the spontaneous pregnancy, or we will just assist you and you can get pregnant. So it is very easy. It is very important to get second day of the period, the ultrasonography by transvaginal.
So I can just put in a nutshell that this is one wonder investigation, which is just one ultrasound, which is done at the right time, which is between day 2 to day 5, which means the day she begins her period is day 1. So anytime after the 2nd to the 5th day, one simple ultrasound, which is done by the internal mode or the transvaginal mode, can give so much of information to finding the problem where the fault lies in the woman. It's the uterus, it's the ovaries, or the tube. So I think in a nutshell, a scan done in the right phase by the right machine and by the right person or the right kind of doctor can give us so much of information in telling us whether there is a fault that needs to be taken further and further evaluation. I think that's fabulous, ma'am. I think ultrasound really gives us so much of information on how the women's system is working and also where the fault is lying. So that is fantastic. So I think there's something which I think our women also get really worried is whether they get worried about getting some blood tests or hormones. Do you think every woman should get her blood test done, or there should be only to some women who should be getting their hormone evaluated when they are not having a baby?
If patient is young, the follicles are very good. Probably in these patients, the hormonal test is not important. We feel that yes, it will be, everything is normal. But definitely if they are more than 35 or 38 years of age, in those cases, we need to know how much is the, number one test is how much is the antral anti-Mullerian hormone level, and the other one can be the FSH, LH, and what is the progesterone level. So we have to do few tests of hormonal level which will show that is there any imbalance or it is absolutely fine. Like in polycystic ovarian syndrome, chances are there this will be revert, like LH will be high and FSH will be low, or it will be equal. If it is that kind, then chances are there the normal ovulation is not going to happen. So the hormonal test, if you get from 2nd day to 5th day of the cycle, you will get the clear-cut picture that how the hormones in the body, and whether if you will take any ovulatory drug or injections, it is going to have the sensitivity or not. You will be having the advantage or not. Whether the egg will form or not, it will give the very beautiful picture by simple hormonal test. In one prick, one can get all information.
So these are the tests which we call as hormone evaluation to tell whether her reserves are good. And also when we are having any doubts, like if the ovaries on an ultrasound show us they are big, they're looking like small cysts, which we call polycystic ovaries, then one needs to go in for a hormone evaluation. I think we should also add that we are not doing it very regularly, but to a woman who is not having regular cycles, that means she doesn't have a 28-day cycle, then we may think of anovulation. That means she doesn't form eggs. We may need to get further investigations like the hormones of progesterone. But even if she has a regular cycle and there is a woman who wants to know, doctor, am I very sure that I form an egg? Then on a day 21 of her period, if we get a hormone test called progesterone test, that also will give us 100% clarity. Yes, you form eggs, and also that egg is good enough to give you a pregnancy. Am I right, ma'am? That is something we should also stress to our patients, that that these are also some things that can add to our knowledge besides doing an ultrasound. So the
Nina, there are few questions, I think, in the chat box. Okay. We can take the question.
Yes, brilliant. I think I can see some questions. There's Meenal, who is asking us a question that I had a normal first pregnancy, but I'm not able to get pregnant the second time. What is wrong? So Meenal has a question. I think Meenal, ma'am, would you like to answer, or would you like to take it further, or how would you, sir? Okay.
Carry on, please.
So,
yes.
Yeah. So Meenal, there are some things which we would want to know. that was this first pregnancy spontaneous? That means you needed help, or you did not, you needed to go to a doctor, or you needed some medications, or was it a spontaneous? But I presume that if you had a normal first pregnancy, this should be a pregnancy where you did not need to make efforts. So there are a few things that I want like to know. What is your current age? And what was the age of your child? That means what is the gap now between your first pregnancy? So I would also want to know that, are your periods getting irregular? First thing. Have you gained weight, as we want to know? Have you put on weight? Because a simple thing could be that your weight could be a problem. Also, what you want to know that we would want you get an ultrasound done on the second day, because what we are talking of women trying to have a pregnancy for the first time or the second time, the evaluation, the investigation almost remain the same. So we want to know whether your eggs are forming, and since you had a child normally, but still we would know, because if you're on age beyond 35, then certainly we would want you to get to your doctor or specialist earlier, get your day 2 to day 5 scan done. Let's check for your ovulation and also get your tubes evaluated by simple test. Simultaneously, if we know the problem, it's good to tackle it. But if you want, we would like to give you simple solutions like a healthy lifestyle. Check in for your husband's semen as well, because not that you have had a baby, the semen is a very labile kind of a test where the semen parameters can change, and that's how we would take it. Okay, I think there is another question which is in the chat box coming from Suman. I think, ma'am, you can take this. She has been having very painful menstrual cycles, and she is taking painkiller every time that she has to have a periods. So, and again, I am having problem because she says she's not getting to become pregnant. And those, I mean, her fears are that will I have problems if I get pregnant in the future? I am 27 years old and I'm married for just 9 months. So I think there's something where we need to get to Suman, because though she's not old, she's young by our present day and age. But would you like to point out that she's married for 9 months? Should she said get worried, and are we getting a lead from her story or her symptoms?
Suman, you are 27 years old and 9 months pregnant, 9 months married life. You enjoy your life. Painful menstruation has no problem with the pregnancy at all. And I think each lady takes some medication during period when it is absolutely painful. So there is no harm. There is nothing if you are taking some mefenamic acid or some diclofenac during this time. It is not going to hamper your pregnancy time if you want to conceive. It shows that ovulation is occurring and you have plenty of eggs, and it is a absolutely regular cycle. You should not have fear. Enjoy your life, and when you plan accordingly, then naturally you can conceive. There should not be any problem at all. So all the best for you for the future.
I'll just add here one thing, ma'am. Suman is saying that I think which says so, and you've just married for 9 months. But if your pain needs a lot of painkillers, I would still feel that we should get a scan, because if it has been there for long, we must also think of endometriosis, because this is something which needs a little bit of concern. So I would suggest, well, do enjoy your pregnancy, as madam has rightly said, but let's get one ultrasound done to be relaxed completely, because endometriosis can sometimes give us some problems in the future. So we are not very worried, but still we would want you to have a scan, because the problem of endometriosis, where the lining of the womb gets placed outside beyond the lining and comes on the ovaries, can be a source of investigation where it can be picked up very nicely on an ultrasound. What do you feel, ma'am? Should we sort of suggest
of course, this pain will be increasing in intensity every month. If it is something like this, then definitely yes, you need to go for the ultrasonography. But if you think that when you have the period before starting, and as soon as the flow increases, the period vanishes, then there is no need of taking any consultation for that. So you just check whether it is increasing every time in the menstrual cycle, then definitely you should get one scan and to find out if you are harboring any endometriosis or not. There is another question, Nina. that what is the
Yes.
ideal time to go for the gynecological checkup after marriage for the timing of conception?
Yeah, I think it's Mr. Bhuyan who is asking. I think it's something which you have to put in point. See, as we've said that if you've been trying for 1 year, I mean, you are following the fertile period, you're chasing your fertile period, and you know that in a regular period between 10th to the 18th day, the couple is having a regular intercourse, which means they at least have a frequency of alternate day. And despite that, you're not having a baby, then 1 year is a time or a window that we give to the couple to try for having a natural conception. If it doesn't happen, because in up to 1/3 to 45%, that means 33 to 45% of couples should have a baby if nothing is problematic. If there is no problem, then if within 1 year there should be a pregnancy. So if it doesn't happen in that 1 year period of trying, then that's the time when the couple should go, or the woman should go to a gynecologist and get a checkup. However, there are some times when we would want the couple to go early. That means they should not wait for that window of 1 year. Like she's more than 35 years, because that's a time when I would say yes, you should start getting worried within 6 to 9 months. If she has a history which is very strongly suggestive of endometriosis, that means she has extremely painful periods, she has been right from adolescent needing a lot of painkillers and the pain is worsening. Or if in the husband there is a strong history which gives us a hint that there could be an abnormality in his sperms, and we get some lead like there is a history of a varicocele, if he's had some surgery in the childhood, and if we, from the history we make, or if there is a problem in the sexual activities which gives us some lead, then 1 year would be longer. Also, I would point out that when the woman has irregular cycles, that means clearly she just gets a period once in 2 or 3 months. That is again a reason that she must get to her gynecologist, because we could pick the problem of polycystic ovaries earlier rather than wait for that window of 1 year, or maybe get her to get investigated earlier. So I think if we look at a 1 year of trying and nothing works, then it's a good idea to visit a gynecologist. I hope I answered your question.
I will add here, if the female's age is more than 38, then also she should not wait for whole 1 year. She should come within 6 months of trying, because after that the ovarian reserve decreases. So it's better to consult doctor, and right in time they should get the advices.
Okay, that's really nice, ma'am, for giving. I think I have another, we can see another question which is coming from Avanti. She says, my husband is not ready to take the step to parenthood. He is like, we should wait for some more days. I am 33-year-old. How do I convince my husband? What immediate health checkups should I do?
So Avanti, I don't know what kind of profession are you and your husband, why he's not ready. I do not know how long you are married, but you are 33. Definitely, this is the right time. Rather, you should work hard on this. And both of you, the couple, should go to the nearest doctor to find out what can be the reason. If your relationship, as we said already, that alternate day during the fertile period, if you have the relation, then pregnancy should occur. If it has not occurred, number one reason should be the checkup of the male partner, because sometimes the alcohol, smoking, or working in a heated environment, or tight undergarment in the night time, these all, other than the pathological causes, these can decrease the sperm count. So there can be the problem of this, unless otherwise he had a surgery in childhood that we have already mentioned. And in youth, you should go through one ultrasonography, that how much is the ovarian reserve, and definitely you require one hormonal assessment also, that everything is fine. If the antral follicular count, the eggs in the ovary are absolutely okay, then probably you can wait little, but you are already 33. After 35, the store decreases. and more aneuploidy, means abnormal eggs may come. So chances will be little difficult to conceive spontaneously. So I think you should go at earliest, and doctors will give you the good counseling, and they will convince your husband also that yes, it can be, you can be treated for that, you can be treated, and probably you will get the right advices, right
I think
advices.
one thing you can show your husband the recording of this program. I'm sure when he hears this, he will be convinced because you are 33, you have a good chance. And that will be the way. And I think what health checkup, you should start taking folic acid, because that is one thing which is what we should advise
Yes.
all women who are planning. So, that is something. So there is another question which is coming from Keiki, that I have very regular periods. My weight is 70 kilo and she's overweight. And sometimes, the periods are irregular, and not only they're irregular, they're even painful. Now she says that I'm 29, I've got married for 2 months. So she is having irregular periods which are painful. She's 29. Madam, do you think we should advise her something special, or how should we go about talking to her?
See, she's obese, so she
Keiki is,
should
yes,
reduce.
overweight.
Yes, I know. During this COVID time, everybody is sitting at home and eating lots of junk. Probably this may be the reason everybody has gained little weight. So we have to reduce at minimum of 5%. If you reduce, dear, then it will work out properly. And of course, irregular menstruation are one of the signs that egg is not forming. So it's better you consult your doctor close by, and they will give you the right advice about it, because you have to take the advice. You are 29 only, so there should not be any problem later. So you just take the advice of your doctor.
Okay, now this is Maya Kamath, who is a story which is long, and she says that she's married for 8 years. She has AMH issues. AMH is just 0.9. 3 IUIs were done, failed. Husband had varicocele surgery. And then she had 2 IVF cycles in which, because ICSI was done, because the motility issue was there. After that, she had a natural conception which resulted in an ectopic. She's had ectopic again even after an IVF. Now her age is 35. What can I do to have a successful pregnancy? I am overweight too. So she has issues of low results by having low AMH. I understand there's a male factor because there is a varicocele surgery, after which motility improved. We don't know, but ICSI was done, which has failed. And then I feel there's a tubal fault also, because with a natural conception of an ectopic and a repeat ectopic after an IVF, I think we have 3-4 issues. So, and of course, to add to it, she is 35, though her weight is also a problem. So
I think, Maya, you have gone through lots of trauma, that you had ectopic also, and you have gone through IUI and IVF also. But in IVF, if the ectopic has occurred, that means your tubes are not good and there is hydrosalpinx. So one have to de-link, one have to close that tubal end, which is just attached to the uterus. You have to close it. So whenever IVF will be done, it won't go inside the tube. This is number one thing. And number two, the husband has problem, but ICSI can be done. 0.9 AMH is quite low, but you may be having 2 or 3 or 1 egg, which can have the ICSI. You can try once more in a very good IVF lab, skilled lab, where ICSI can be done. And once the embryos are formed, one can have the PGT, that there should not be any aneuploidy. The embryos are not abnormal, and then they can put inside. By the time you just try to reduce your 5% weight, why I am telling repeatedly that everybody has gained weight. So if you reduce the 5%, then it will be more than enough for you.
And I think, Maya, there's something that you have gone through the trauma. There's something that your, as Madam Pointly said, AMH of 0.9, low but not very dismal. I'm sure if the lab does a good job to create you embryos, I think if they put back in a frozen cycle rather than a fresh cycle, also add, because once there is an ectopic, even we want, because there is some fault where there is the crosstalk, the discussion that happens between, the dialogue that happens between a seed, which is the embryo, and the soil, which is your lining, is probably not very healthy. So in these situations, is resulting either in a failed IVF or an ectopic. If we put them back in a frozen cycle, that means we freeze the embryos after creating good embryos, and then we prepare the lining accordingly. We could probably also add another element of improving the pregnancy chances. I'm sure that will be of another help, which the IVF unit which you consult should sort of offer you. So that will be the advice. Now, Paula Deca asks us that what is the importance of doing a day 2 hormone? So why is day 2 so important, madam? Do you think we can sort of add
we have already discussed, because why we do on day 2, that is the baseline, absolutely baseline hormonal level, because as soon as we reach to day 5, the follicle starts increasing in size, starts liberating the estradiol, and then the FSH level also becomes high. So it won't give the right picture how the baseline hormones in your body are there. So it's better to get on second day of the period. Why? When we do IVF, then when we start either on day 2 or day 3. If you get on day 2, so we will be absolutely clear in our mind that what kind of gonadotropin, what will be the doses, how many pricks you will take. We can assess each and everything to make your eggs. So this is the reason the baseline investigation has to be done, and preferably on the second day of the menstrual cycle.
Remember, the ovary cycle has a cycle which is called a 28-day cycle in a normal woman. So, when you have a cycle, there is like a pattern. So what is the best time when things are just kind of, when you, as an individual wakes up in the morning, he's most fresh, and then the activity goes, and then, by the end of the day, you are tired. Likewise, the ovaries are most fresh when they are baseline. So the baseline time is day 2 to day 5. And that's the reason, as Madam has said, that we get the best snapshot of not only your reserve, but also about how your ovaries will behave. And therefore, we keep a check on the baseline and go further. So I think that is the reason why we need to get tests done on the baseline or the basal day. That's just to put in a nutshell. So I think we have kind of covered a lot of talks about how they say, but ma'am, would you like to sort of, before we have normal questions, to give some kind of tips to our patients? I think we've really covered most of the do's and don'ts on the tests that they do, but some kind of advice that we need to give to the present generation who are really working very hard. And I understand they have a stressful lifestyles. They are stressed on their work front. And again, to add the stress of the society, when their friends or their family asks, you're not having a baby, why you're not having a baby? Some kind of tips of do's and don'ts that we should tell them, what we should do, and some things that can help them have a baby in a better way.
I understand, Nina, that today's society is very, very stressful, because all the women wants to be independent. They work in MNC, and they do lots of working hours are also totally different with their male partner, with their husbands. So I can understand these people have the double work they have to do. But after all, before everything goes away, the stalk of the ovary just vanishes. Before that, we should keep one eye on that, and we should try to find out that this is the right age, and we should take out some time for the baby, for the family, and we should, at least one baby should be there, because I have seen many patients comes later, that they got married at 40, they are coming at 42. By the time, ovarian reserve has become absolutely nil. So then we have a only choice to take a donor egg. So it's better to use your egg and right in time. So we have to take out some time for that also. because once the time goes away, it vanishes, it flies, then it is not going to come back. So please be sure that the right age before 35, it will be very good if you use this time and make your family healthy family.
So can we take another question? This is also a very usual question. If I think Bhavesh would allow us, or you think we should kind of close it. I mean, there's one quick question, Bhavesh. Okay, this is Mithal. Can we take this as the question? Yes. Yeah, because I think this is catching up. The program seems to be sort of getting attraction from a lot of viewers. So this Mithali is 30-year-old. She's not actually trying for a baby, but you know, she has been told she has PCOS. She's overweight. Please explain me. She's not keen to become pregnant right away, but I have PCOS. I'm overweight. Please explain. Can I overcome this situation?
Nina, you answer. We have already answered.
Absolutely, yeah. I think Mithali, we have actually told. See, PCOS is what I would say a problem in which we say it's a diabetes of the ovaries. And like diabetics are overweight, so are PCOS women. So if you're not trying to have a baby and your periods are irregular, the best treatment is lose weight. So you are your best doctor. The moment you start losing weight, your periods will become regular. And even if you don't want to become pregnant now, later you want to have a pregnancy, your pregnancy would be much easier. Not that all PCOS give trouble, but those who are overweight are certainly at a challenge. And therefore, we want you to start having a healthy lifestyle, not just eat right, but also exercise right. Take up, if not to a gym, which are closed these days, probably do some good brisk walking, have a structured, exercise plan of at least 30 to 45 minutes a day. Just say no to junk food. I'm sure this will help you not only make your periods regular, but while you're planning, maybe a year later or 2 years later, to improve your hormone profile and help you conceive faster. Now, Reena says that there is having acrania in my first trimester in 2 consecutive pregnancies. So there was a neural tube defect in which the baby's head did not form, and both the time it was picked up in the first trimester. Then what should be done? Is there some way prior to conception that can help? Reena is worried because she's had 2 pregnancies which have resulted.
Reena, when you were planning, are you taking the folic acid tablets or not? Because when there is a open neural tube defects, this is due to the deficiency of folic acid. And repeatedly it is coming. I do not know that you have taken or not. But in first trimester, when it was diagnosed, definitely you had must have the medical termination of pregnancy. So you should look after during preconceptional time only. You should look after yourself. You should take folic acid. Some micronutrients are also available, which really requires, because if these are deficient, chances are there will be a problem in the babies. And when you plan, at least for 2-3 months before only, you should start this medication to have a healthy pregnancy.
And I would also point out here that I hope you're not on some medications which could be interfering, because there are many times when, not acrania, but sometimes the women are on anti-epileptic drugs or some medications which are being taken long. So it's good if you have any medical disorders which are underlying, should be consulted with your physician or a specialist whom you consult. And certainly besides folic acid, I think we have to look into micronutrients also, which needs to think. Now, I think there is another question which is coming from Jasmine, who is getting her prolactin levels, which are 25. The prolactin levels are, she's 31. She's getting severe high. In fact, I read it 25 point. Okay, my prolactin is 500 nanograms. So this is a high prolactin. 500 nanograms, if I can read. She is having the age of 31, getting severe headache soon after ovulation. And the headache is remaining there for the next 5 to 7 days. I get periods. Will there be any connection between getting headache and prolactin? And yes, am I getting periods soon after that? So prolactin levels which are on the higher side and a headache is the concern. So I think what is getting us here is that, Jasmine, we need to get a brain MRI also, because a 500 nanogram per ml is a higher prolactin level. So the background of headache, am I getting clear that I think we should at least look in, though that's the association of a headache and an ovulation, to me looks a little, I would say casual, not causal, but I think we certainly need to get an evaluation from a neurologist, because a level which is high and headache could be a pointer to something like microadenoma in the pituitary, where we may need to add you some medications like drugs which counter the levels of these high prolactin. Anything, madam, you would like to suggest to Jasmine besides MRI and...
Yes, Jasmine, definitely this prolactin level is high and you need to see some neurologist for this. And of course, headache may be there when the prolactin, that means the pituitary in the brain is slightly bigger, it may be connected. That neurologist will give you the right answer. But if the prolactin is high and if you plan pregnancy, you cannot have, because it causes anovulation. So definitely you need to go to the neurologist to find out, and on medication it will be normal. No surgery probably will be required, and you can have the pregnancy if you really desire in future.
That's all I can see in the chat box. So Bhavesh, can we sort of, okay, there is another one, put me, okay.
Is
so
there
no any more questions that are there? I see none.
Right
I think
now,
that is the last that I could see.
I am watching it on live on Facebook. Also, there is one comment from Jasmine who says that her prolactin is just 25.5.
Okay,
so,
because it's high. Okay, then in that case, Jasmine, that is a normal prolactin. Jasmine, that is perfectly a normal prolactin. But if you're getting severe hind headaches, I would still want you to consult, because if they are persisting. However, ovulation and headache are more causal than casual, more casual than causal. I mean, I really don't see, because the prolactin levels are perfectly fine, but I still feel for your persistent headache, we still would need a consultation with a neurologist. That is what I would like to put in.
Yes, yes.
Because the 500 is 25.500, which is... So I think we can end up here just on a positive note. Yes, infertility is not an uncommon problem. Not having child is an issue which really puts our couples at stress. But I think if you stay positive, there is a way forward. We have answers to a lot of the situations. And I think with newer technologies that are available, we can help you in the journey with your parenthood. But certainly, if you go to a specialist, things would shape up better. And certainly, the right kind of doctor could connect you to get you the right investigations. Anything that, madam, you would like to sort of conclude, and then we would call it a day?
Yes, be stress-free, because stress is a very big element that really causes the disturbance in your brain to the ovary, everything disturbed, and your hormonal level will be absolutely deranged. So you have to be stress-free, do little exercise, and these days we are promoting yoga. So at home also you can do little meditation and yoga. I think it will make you absolutely cool and lots of oxygenation, and you will be absolutely healthy, and there will be the chances of spontaneous pregnancy. Thank you so much. Thank you, DocSpace.
Thank you.
Plus,
thank you so
for making
much,
us be here. Yeah. And I hope we are able to clear many things to our listeners.
Thank you very much. Thank you, Bhavesh. Thank you.
Yes, thank you so much. I think in the first episode of Not Her Fault, we have focused very wonderfully that it's not the lady alone who's responsible. There are reasons beyond the lady's physical conditions which can be contributing, and it's not the lady alone. Let's remember that, friends. There is a component of contribution from the male partner. We will take that up in our subsequent parts of this program, Not Her Fault, part 2. And then there are other causes. But one thing is very clear with the advice from both the doctors, that it's very important to maintain extremely good physical health, eat right, have a good mental framework, have a positive approach. I think that helps in all phases of life, whether you're aiming for pregnancy or you're just aiming for your overall good well-being. So that's the very clear message from both these doctors. Let's focus on being positive. Let's focus on being healthy so that even Corona doesn't come anywhere near us, and we can definitely look forward to healthier families, bigger families in days to come. With this, I thank once again both our panelists, Dr. Sudha and Dr. Neena, for taking out their time in educating the lay public. And we've had some wonderful responses. Do keep posting your questions. We will try to answer them at some other parts of our series. And please do share this to your brothers, to your male friends, to all your relations, that it's not her fault alone. Please help us spread that word. And I thank Indian Fertility Society and the leadership of Dr. Sudha and Dr. Neena for taking up this initiative and spreading this message. Thank you so much, everyone. Stay safe, stay healthy. Good night.